Hello, I'm Congressman Dan Newhouse, and here with me is the Central Washington Fentanyl Task Force. Today marks the final meeting of this group, and where we are proud to release a report which outlines our comprehensive work over the last year and a half to help mitigate the influence of fentanyl and the crisis that it's causing in our communities. I first want to thank every member of the task force. We are very fortunate in our area to have such a diverse group of professionals in almost every sector you can imagine. From individuals who have firsthand experience in substance recovery, law enforcement officers, tribal representatives, medical professionals. This task force represents all of us who have been impacted by this issue in one way or another. But let me tell you something else. It was Andy Wonacott's story which really brought this crisis into the light and made me realize that something has to be done. Andy has been an incredible asset to our team. And after first hearing his story about his two sons, both victims of the crisis, tell you what, I jumped in head first to find out what we in our community could do. So through my work on the select committee on the CCP, we discovered that 97% of the fentanyl and its precursors come from China. And chemical companies in that country are supported by the Chinese Communist Party. The CCP actively subsidizes, awards, invests, they incentivize these chemical companies, while the substances that they are incentivizing are illegal in their own country. These precursors are then processed and distributed across our southern as well as our northern borders by the cartels. We as a nation are unfortunately failing in our response in these facts. Until the law is enforced and we crack down on this crisis, fentanyl will continue to be here and American families will continue to suffer the consequences. That's where people like those next to me here come in. The guiding question behind our task force has been, how do we keep people safe, knowing that fentanyl is already here in our communities? This report that we're publishing today is part of the answer to that question. It'll be a resource for communities to turn to, and I'm hopeful, a pathway for elected officials to follow. We've outlined more than 75 recommendations to be implemented at the federal, the state, and the local levels to address the crisis from a supply and demand approach. We identified the most effective funding mechanisms for how the roughly $20 billion in federal money for law enforcement and $25 billion for treatment and prevention can best be used on a practical level in our communities, but most importantly, knowing where it goes, where it matters. As a member of the House Appropriations Committee responsible for allocating federal funds, these findings have been included in my advocacy on the committee and have resonated with my colleagues in Congress. As I shared with the task force earlier, this issue is truly a bipartisan issue. Now, before I turn it over to other members of the task force who may want to say a few words, I want to emphasize how important it is that this work does not end today. This crisis is not going away. And while this task force has helped equip all of us with ammunition that we can take back to our respective areas to fight, to save lives, improve mental health, and treat substance abuse disorder, must continue every single day. So I want to thank all of my task force members for their hard work. With that, I'll now turn it over to members of the task force for their comments, and then we'll end with a few questions after everyone's had a chance to speak. So first I want to call, and then you can come up voluntarily, but I'd like to have Mr. Andy Wonacott come first. Andy?
Thank you, Dan. Hi, my name's Andy Wonacott. I'm a community member. To give you some background, I lost my first son in 2021, April of 2021, to fentanyl crisis, fentanyl poisoning. He was a great kid in school, He played football, he did acting, joined the Air Force, had a great career lined out, and then fentanyl poisoning killed him. Done. About a year later, in November of 2022, I have another son who was in the aerospace industry, and again, fentanyl poisoning killed him. If fentanyl has not touched you or your family, it will. 100,000 people a year are dying and being poisoned by this drug. As Dan mentioned, China is at the heart of it. We have to do something to stop this scourge on our American soil. There's another aspect of it, and that is the treatment of our children and our families that are addicted to it. We have to focus on that also, and that's what this task force has been doing. And I just want to thank everybody on this task force that have been working on this for the past 2 years. It is given me great hope that we can get to somewhere and actually make a difference. Thank you.
Well, good afternoon. I'm Dr. Raul Garcia, and I've been an emergency physician for 26 years. This crisis has been the worst that I have seen as an emergency physician. This has been the worst killer of any drug that I have seen in the emergency department over the last 26 years. I walked myself from Toppenish Hospital to Seattle this last July, 185 miles, to raise awareness to this great crisis in America and to honor everyone that has died from this senseless death. And throughout our towns and cities, I got to talk to many who have lost loved ones, neighbors, friends, and most important, families. I talked to you as a physician and as a father. Our oldest son, we almost lost to fentanyl, and we were able to save him. But a lot of people are not that lucky, and this remains one of the worst crises in American history. And I want to be grateful to Dan and the members of this task force for having the honor to participate in finding solutions to this great problem that doesn't end today, and it will not end until we get this killer out of our streets, concentrating in prevention, getting rid of the supply, and then opening our hearts and minds to the addiction world and bringing to solutions so these individuals could come back to their families and our community. Thank you very much.
Good afternoon. I am Wapto Fire Chief Bob Clark. I represent a community of about 4,500 people. We have a major fentanyl problem in our community. We're a small community with a medium and a large city problem. Just to give you a few statistics, we have had 83 calls for service this month, 27 of those are fentanyl overdoses, 1 in 3, 33%. Of those 27, we saved all but one. One passed away. We're averaging 1 fentanyl overdose per day. We used to be 1 or 2 a week. So Congressman Newhouse came out with us last August, toured the city, and saw firsthand what we're dealing with. I'm sad to report it's gotten worse since then, sir. We have a batch of fentanyl in town right now. It's like playing Russian roulette. These people do not know what they're getting. They may make it, they may not. Fortunately, most of them have Narcan close by to save them. On Thursday, October 17th, we had 3 separate overdoses in 5 minutes. That's staggering. 2 of them were about a block apart, another one was like 3 blocks away. 2 days later, we had 2 in 20 minutes. It's coming in batches. And it's sad, it really is. We're a small fire EMS agency. I'm the only full-time person there. Fortunately, with Chief Craig, Janice, and his department, we fight this every day. We're fighting this tooth and nail every day, fighting for survival for our citizens. So, Congressman, just thank you for your support, and we'll do anything we can to help curb this crisis.
Commissioner Amanda McKinny, and I think I'll probably just say, as the lone mother up here, that this is something that really touches the hearts and minds of all of us. And as Andy mentioned, even if it has not touched your family directly, We all see it when we walk down the streets with our children. It is heartbreaking to explain what our children are witnessing as we go around our community that we love. It is true compassion that we want to extend that hand, and yet right now society doesn't seem to be able to figure out how we can do so successfully to save these people from the throes of addiction, while also addressing where it is flowing in from. The awareness that has been brought to this issue is something that I thank Congressman Newhouse for greatly, and everyone on this stage. But the moms and dads out there, this is a kitchen table issue, and just in these last 2 years, it has really risen to the top of conversation. So we can be grateful for that, but that work is not done, it must continue. I would just also like to add that my previous professional experience has been in banking, and the CCP does operate some extensive banking networks. The DEA has done extensive work on this. We'd love to see more work done internationally with our global partners to really look at how we can cut banking to these cartels and to the CCP, because it really all has to do with money, and it's a money-making scheme, and Americans are suffering for it. So I want to thank you again, Congressman Newhouse, and everyone needs to just keep talking about this at the kitchen table to save our children's lives.
I'm David Elifson, a retired Superior Court judge from Yakima. I'm a current board member for Safe Yakima Valley. And the task force that was initiated or created by Congressman Newhouse was really a call to action. And Safe Yakima became, jumped forward, and following the task force initiatives and lead, we created 3 sequential intercept mapping efforts. 60 people from Yakima, 50 I believe in Benton County, and roughly 40 in Grant County, all gathered together to identify the resources that we have in our communities and the gaps so that we can address the fentanyl issue. These were people that spent an entire day. They carved out from their executive level days, an entire day just to examine this issue. We're awaiting the final report now. Again, 3 counties, almost 150 people. It takes time to put together, but we're looking for a final, should have had it this last week, but we didn't get it. I will tell you that we are going to move forward. It is not stopping. We're going to mobilize all 3 counties and keep pushing forward. One of the conclusions that was addressed in Congressman Newhouse's report was the OD mapping effort. OD mapping is really an effort to quantify what's happening. We all know about the number of deaths, and those are certainly important. But OD mapping allows us to understand the scope of the issue. Not just those that have passed, but other victims, those who have survived and are plagued by the fentanyl crisis. It allows us to understand that problem better by providing data. It also allows us to get a better grip on what the chief described as, I guess, an operational issue is we know when a spike comes. With OD mapping, fire departments, the tribe, various agencies are going to be providing data on a day-to-day basis so that we know when bad fentanyl is arriving or fentanyl is, with some extra strength to it, is arriving that's going to take people's lives. Allows quicker responses. That's all comes out of, in some fashion, from Congressman Newhouse's task force, and we appreciate very much the work he's put into it. Thank you.
I'm Sheriff Udell with the Yakima County Sheriff's Office, and I think the thing that strikes me the most about this fentanyl task force that Congressman Newhouse put together is that we're working together collaboratively to find solutions. And not just for the fentanyl crisis. I mean, that's the driver. That is what everyone's looking at, what we're talking about is what's causing so much pain and anguish across our country. But if the communities and the government follow the recommendations in this report, they will find positives, not just in fentanyl, but other drug uses, including alcohol, crime, all these things that plague our society. Fentanyl is just the ultimate symptom. It's all these other things that should be helped by what Congressman Newhouse and all these fine gentlemen
and young ladies have worked together to come together and develop. So many thanks to the Congressman for making sure that we got in the same room and are coming up with solutions. Thank you.
Well, that's the end of our conference. Appreciate very much, again, the task force members for putting in their time and energy, coming up with some real life recommendations so that we can find solutions to this crisis. And as I told them in our final minutes of our meeting, we may not be convening another meeting soon, but the work is not done. And we definitely will be in contact and continue working towards solutions. So thank you very much.